Hi, welcome to RAAONLINE. I'm Dr. Alice, Associate Professor in Microbiology. In today's lecture, I'll be talking about Campylobacter and Helicobacter. The learning objectives of the lecture would be the morphology, virulence factors, pathogenesis and clinical manifestations and treatment of Campylobacter jejuni infection. And I'll also be talking about the morphology, virulence factors, pathogenesis, clinical manifestations and the treatment modalities for Helicobacter pylori infection. So first let's move on to this case. Here a 37-year-old Caucasian male came to the emergency department presenting with 2 days of right lower quadrant abdominal pain with elevated temperature, leukocytosis, diarrhea and chills after preparing turkey for a Thanksgiving meal. Gram stain of direct stool microscopy revealed gram-negative S-shaped or spiral-shaped bacteria. So what is the probable causative agent for this condition? So the things to note here is the patient had diarrhea and after eating turkey for a Thanksgiving meal. Probably the turkey would have been contaminated with a bacteria. Okay. So poultry food poisoning is very common with bacteria like Campylobacter. And when you look at the morphology of this bacteria, it is gram-negative and it is S-shaped. It is spiral-shaped bacteria. Okay. So this gives a clue that it could be Campylobacter jejuni. So now let's look into the history of this particular bacteria, Campylobacter. This was first isolated in the year 1909 from spontaneous abortions in livestock, and they named the bacteria as Vibrio foetus. Okay. And in the year 1970, this bacteria gained a lot of importance when they recognized that it's a common cause of diarrheal disease in humans. And now this particular Campylobacter infection causing diarrhea is very common in developed countries when compared to this incidence of Salmonella and Shigella infection. It remains to be higher. And in developed countries like US, the incidence is very high. Say more than 2 million cases occur annually. And in nations like United Kingdom, the incidence is also very high, and the estimated deaths is around 200 to 700 deaths annually. So coming to the morphology of this particular bacteria, so it is a spiral-shaped bacteria, and that is why initially they named it's like a kind of curved bacteria, and hence they named initially as Vibrio foetus. And later they changed the name into Campylobacter foetus or other species like Campylobacter jejuni. So this is a gram-negative bacteria, and the size of the bacteria is 0.2 to 0.5 micrometer thick and 5 micrometer long. So it looks like a comma, and it may also occur as S-shaped with multiple spirals. Okay, and it's a motile bacteria. And the bacteria has a polar flagella, and there is a flagella present at one or both the poles. So now it is a microaerophilic bacteria. So it grows in no condition where there is less oxygen tension. So it's preferably grows when you incubate it in a carbon dioxide incubator. And it is a thermophilic bacteria, and it grows well at 42 degrees Celsius. But Campylobacter foetus, it's not thermophilic, so that helps you to differentiate between jejuni and foetus. And it is oxidase positive bacteria. So this is the morphology of Campylobacter. So they are curved bacteria. It will be S-shaped in nature, or sometimes it will have multiple spirals. So what are the species of Campylobacter that has got medical importance? You have Campylobacter jejuni, coli, Larry, and Upsaliensis hyointestinalis. These are the species which can cause diarrheal disease, and extraintestinal infection is mainly caused by Campylobacter fetus. So it can cause bacteremia and other manifestations. And abscesses can also be caused by some species of Campylobacter like Sputorum and Conciscus. So coming to Campylobacter jejuni, so it is a common cause of diarrhea in developed countries. In developing countries, it occurs as a hyperendemic disease. And it's a zoonotic disease because this particular bacteria is present as an intestinal flora in domestic animals, especially cattle, sheep or swine, and also in poultries, okay, birds especially. And organism will be spread or shed in the feces. A source of infection here will be animal origin, especially meat or poultry products, and also contaminated raw milk. The mode of transmission is by ingestion, and household pets can also transmit the infection. So it's a kind of direct contact, especially dogs and cats can also transmit the infection. Very less dose is needed to cause the infection. So the infective dose here is less than 500 organisms. So this how it gets transmitted. So as I said, mainly domestic animals remain as a source of infection, like cattle, sheep or swine, and also these poultries, they will also be the source of infection, right? So it can be transmitted by meat or poultry products, and also raw milk that is contaminated with the organism. So what are the virulence factors of Campylobacter jejuni? First thing is its motility. Here it's got that polar flagella that helps the organism to move in the intestinal mucosa and to get colonized in the intestine. The second is adhesion. So it tightly adheres to the intestinal wall in order to initiate the infection. Third, this lipopolysaccharide, since the gram-negative bacteria, the lipopolysaccharide also contributes some virulent mechanism, and it produces toxins. Two toxins it produces. One is cytolethal distending toxin. It will stop the cell growth, and further it will cause cell death, which will result in bloody diarrhea. And the second one is the enterotoxin.